Good morning, Yatan Pal sir. Can you hear me?
Hello. Yeah, I can hear you.
Yes, sir. Perfect, sir. We can see you, sir.
Yeah, so can I quickly share my slide so that to check that whether I'm able to share it?
Sure, sir. Sure.
Please confirm whether you can see it.
Yes, sir. It's visible.
Okay, then I'm stopping it. So I'll be getting around 15 minutes to speak, I believe.
Yes, sir. Around
Okay.
that time only.
So I'll wait till maybe 2-3 minutes before 12. I'll join again. Okay.
Perfect. Thank you, sir. Thank you.
Bye.
Okay. Yeah, 1 second, I'll just cut this call. We'll like check the audio.
Yes, sir.
Yeah. Hello. Yeah,
Yes,
Amit.
sir. Yes, sir. I can hear you, sir. Your video is also very
So
clear.
it's audible, no?
Yes, sir. It's audible and video is also clear.
Okay. So it's everything is right from my side, right?
Yes, sir. Perfect. Not an issue.
Okay. So what is the operandi? Like how would it go?
We'll start at 12 only. The moderator would take over and he would give a brief about this session and how we are going to proceed with it.
Okay. Okay. Fine. Fine.
Okay. Thank you, sir.
Oh, okay. Right. Right.
Good morning, Payali ma'am.
Yeah, good morning.
Can you hear me?
Yes, I can hear you.
Perfect. We can hear you, ma'am. Okay. Could we also check the video? Perfect, ma'am.
So, am I audible?
Audible, Adarsh.
Hi Risha, am I audible?
Hello. हाँ, one more thing. Presentation तो मैंने share नहीं किया आपके साथ. I can share it here, right?
Yes, ma'am, you can share it right over here.
आवाज आ रही है मेरी? Am I audible?
Audible.
Am I audible?
Perfect.
One, two, three. Check. ठीक है.
Hi, am I audible?
Audible. Audible.
Are you guys able to see the PPT?
Yeah, we can see it.
Fine, fine.
Can you please allow me to share the screen just for once because I want to see whether it is coming or not.
Sure, ma'am. Sure, ma'am.
Yeah.
Yes, ma'am, we can. Yes, ma'am, we can. So it's perfectly visible.
Hello, everybody. Good afternoon. We welcome you all to today's event, which is being conducted under Sashakt Bharat program, organized by the Ministry of Social Justice and Empowerment. The Nasha Mukt Bharat Abhiyaan began in 2020, which has today expanded to 372 districts of the country. It has brought together multiple stakeholders to work on the issue of drug dependency. Through the period of the Abhiyan, there is a constant reminder of looking at the issue of drug use from an intersectional lens. This is primarily because both the responsibility of the possibility of falling into the trap of drug use, and the intensity of its impact varies widely depending on multiple factors like socio-cultural identity of a person, region, gender, and other factors. With this holistic lens, we have brought together elements of sustainable living, drug use, and gender based violence. This 15-day program of Sashakt Bharat has been conceptualized under Nasha Mukt Bharat Abhiyaan to discuss the most pressing issues currently being faced by the country. This program commenced on 28th of November 2022 and shall go on till 9th of December 2022, where a host of events will be conducted, including panel discussions, webinars, competitions for awareness and sensitization purposes. To capture this intersectionality better, today we shall be discussing patterns of drug use in the context of the Sustainable Development Goals. The 2030 Agenda for Sustainable Development, adopted by all United Nations member states in 2015, provides a shared blueprint for peace and prosperity for people and the planet, now and in the future. At its heart are the 17 Sustainable Development Goals, which are an urgent call for action by all countries developed and developing in a global partnership. We will be focusing on 3 of the goals primarily for today. The first one being SDG 3 for good health and well-being, with special focus on SDG target 3.5, that is substance use, to strengthen the prevention and treatment of substance use, including narcotic drug use and harmful use of alcohol. Along with this, we will be focusing on SDG 5, which stands for gender equality, and SDG 10, that talks about reduced inequalities. This webinar has been conceptualized to bring together Nasha Mukt Bharat Abhiyaan, which is championed nationwide by the Ministry of Social Justice and Empowerment, along with Ministry of Forest, Environment and Climate Change initiative called Mission LiFE, and Ministry of Rural Development's Nai Chetna campaign against gender-based discrimination, specifically gender-based violence. Hence, we aim to bring together and discuss the intersection of drug use, gender-based violence, and sustainable life alternatives. To discuss these three in tandem with each other, we have been graced by the participation of 3 esteemed panelists: Dr. Yatan Pal Singh Balara, Professor of Psychiatry at AIIMS, Delhi; Dr. Pyali Mandal, Additional Professor at National Drug Dependence Treatment Center and Department of Psychiatry, AIIMS; and Dr. KP Manojan, Assistant Professor, Tuljapur Campus, School of Rural Development. I would now hand it over to Guru for taking the conversation forward. Thank you. Just 1 second. We have a technical issue.
Hello, am I audible now?
Audible.
Yes, thank you. So before beginning the discussion, we would like to introduce the element of our panel discussions more closely. So now I request Ms. Pranjali to give a short presentation on Nasha Mukt Bharat Abhiyaan. Thank you.
Is my screen visible? Okay, good afternoon, everybody. I shall now begin with my presentation on Nasha Mukt Bharat Abhiyaan, which is currently being implemented in 372 districts across India. As you can see on your screen, on 15th August 2022, we have identified over 372 districts in 32 states of India. The objectives of Abhiyaan are as follows. First, it aims to create awareness in the community through various on-ground activities and social media campaigns. It then focuses on higher educational institutions, universities, schools to reach as much of youth population as possible. Third objective is community outreach and identification of the dependent population. Then we also focus on counseling, treatment services, and rehabilitation facilities. Capacity building of the service providers is another objective under the Abhiyaan. And last but not the least, we focus on mental and physical well-being of youth and adolescent. As you can see on your screens, on 15th of August 2020, the Abhiyaan was vigorously launched in about 272 districts across the country. Here are a few glimpses from the launch events. Till now, we have over 8,000 master volunteers working with us on ground who have been recruited from various social diverse backgrounds and fields. These master volunteers have been trained using the training material that has been developed by the ministry, and they have been backed with all the resources necessary for taking out the NMBA programs on field. Here are a few pictures from the master volunteers trainings that have been given in various states of India. Another aim of the Nasha Mukt Bharat Abhiyaan is to focus on those social groups that may otherwise be overlooked in the process of de-addiction in India. And thus, NMBA focuses on women-led and women-centered programs, which are undertaken through a lot of Mahila Mandals, and it aims to rope in various Anganwadi workers, Jivika Didis, and a lot of women's self-help groups. Then we have a lot of youth programs being organized on the grassroots. Thousands of youth clubs and committees have been formed. More than 4,000 activities have been taken up by Yuva Mandal, and we continue to reach a lot of young people who are a major target population under NMBA. Then we, as I have mentioned before, we focus on educational institutions, and thus we carry out a lot of programs in educational institutions and collaborate with universities. We have collaborated with many universities like Christ University, VIT, Manipal Academy, etc. And a lot of activities are being conducted in these institutions to reach young people, to provide them a mechanism that will address their issues and take the process forward. Then NMBA recognizes border villages as important sites that should be tapped for special awareness programs. And it has listed down a lot of activities that can be undertaken, like involving military personnel and parliamentary station there, community mobilization, etc. We have a lot of community programs going on in various districts across the country. These programs are being held vigorously, and they are usually very creative initiatives like Nukkad Nataks, awareness rallies, competitions, wall paintings, etc. Then we see social media and technology as a very important tool to reach as many people as possible, especially the youth. And thus we also offer youth internships through which many young people are connecting with other young people. And we have reached more than 5 lakh people through social media and such creative mobilization. Then we have a very dedicated NMBA website, which has a live dashboard with all the data that NMBA has. And then it also has a lot of important resources like expert forum and discussion pages and the addiction helpline and a lot more than that. We also organize regular panel discussions such as this one. And then there are monthly newsletters which provide a lot of information and resources to take the work of NMBA forward. We also have an online training program on substance use, which can be accessed through the online portal of TAPAS. It offers a course which has 12 modules under it, which can be very useful for anybody who would be interested in it. There is also a mission of Chetna going on, which aims to sensitize students of 11 to 16 years and also connects with teachers and parents on drug dependence and related issues. To talk about facts and numbers, today we have covered more than 3 crore people, and that is a huge number. Apart from that, more than 55,000 educational institutions have been covered, more than 32 lakh women have been reached, and more than 1.59 crore youth is today associated with NMBA. With NMBA 2.0, which was launched on 15th of August 2022, 100 more districts were added to an already established list of 272 districts to take forward the work of NMBA and to fulfill the aim of the making India drug-free. That's all with NMBA, Nasha Mukt Bharat Abhiyaan PPT, and now
Thank you, Pranjali, for sharing with us about Nasha Mukt Bharat Abhiyaan. Now I would like to request Mr. Adarsh to give a short presentation on Nai Chetna campaign. Thank you.
Others are not audible.
Morning. Are you able to hear me now?
Yeah.
Good morning, everyone. So, the Nai Chetna or Nav Chetna campaign, it's a national gender campaign that has been launched by the Ministry of Rural Development, and many associated state as well as national level ministries are being a part of this campaign, and they are all working towards addressing gender-based violence. Can you move? Next slide, please. So briefly talking about campaign, it's annual campaign that was launched on 25th of November this year by our Honorable President of India. And it will be an annual campaign. Every year we'll be having different themes. And the scope is to lead national level campaigns on community level by all the states, UTs, as well as all the ministries. So we are targeting community development groups, frontline workers, line departments, Panchayati Raj institutions, and civil society organizations. Next, please. So the goal is specifically targeted towards women and genders diverse individuals for addressing the structural barriers that they have for a dignified life, and they should not be fearing or having any kind of discrimination or violence based on their identities. Now, as we all are very aware that gender-based violence is very closely linked to substance use, where women and persons from marginalized genders are often prone to violence from drug dependence, and they are being more vulnerable to addiction due to societal discrimination. Through the panel discussion, we will try to engage our panelists in unwrapping the link between gender-based violence and drug use. Thank you.
Thank you, Adarsh. Now I request Mr. Rahan to present on Mission LiFE. Thank you.
Good afternoon, everyone. My name is Rehan, and I will be giving a brief overview of Mission LiFE, which is an acronym for Lifestyle for Environment. So the basic premise behind Mission LiFE is the fact that a significant portion of global carbon emissions are a result of simple lifestyle choices that we as individuals make in our daily lives. For instance, taking a cab instead of the metro, asking for poly bags where we could have easily carried a bag from our home. According to the United Nations, if only, am I audible? If only 1 billion people out of the 8 billion of us decided to make sustainable life choices, the total global carbon emissions could be reduced by over 20%. Therefore, it is with this view that Mission Life has been launched. It aims to influence an environmentally conscious lifestyle among individuals as well as organizations by focusing on three major shifts. The first is changing demand by influencing a sustainable lifestyle among individuals. The second is changing supply to adapt to changing demands. And finally, changing policy to facilitate the previous two, which are changing demand and changing supply. So, furthering upon that, a comprehensive but non-exhaustive list of 75 life actions for individuals, communities, and institutions grouped under 7 broad categories has been developed as well. And we shall be going over those now. So, the first is saving energy through actions such as using public transport wherever possible, using biogas for cooking and heating, among others. The next is saving water, using innovative conservation techniques such as harvesting rainwater, etc. The next is minimizing the usage of single-use plastic and gradually replacing them with sustainable alternatives. Furthermore, we also need to reduce the amount of e-waste we produce, in addition to which we also need to transform our food system into a sustainable one. And along with that, we need to minimize the amount of waste we produce by, for example, choosing to donate instead of throwing stuff away. And finally, we also need to adopt healthier lifestyles ourselves. So this is it from my side. Back to you, Shreya.
Thank you, Rehan. So moving forward, we would like to begin our panel discussion. Now it's time to call upon our esteemed panelists. Our first panelist, Dr. Yatanpal Singh Banhara, will be speaking to us about Sustainable Development Goal 3 on good health and well-being and its linkage with drug use. So now I would like to give a brief introduction on Dr. Yatanpal Singh Banhara. He is currently serving as a professor of psychiatry at All India Institute of Medical Science, New Delhi, India. At AIIMS, he runs the Dual Diagnosis Clinic and Behavioral Addiction Clinic. He is serving as Secretary General of the World Association on Dual Disorders. Dr. Balhara offers consultancy to World Health Organization and UNODC and is a global master trainer on drug demand reduction for the Colombo Plan and UNODC. Dr. Balghara is coordinator of Master, an online resource hub and telehealth portal on mental health and addictive disorders. He has published more than 250 research papers in peer-reviewed journals on issues related to addictive disorders and mental health. We are happy to welcome you, sir. Thank you.
Thank you. Good afternoon. And for this particular session, I have prepared a brief presentation. So I'll be sharing my screen now so that you can all see my slides. So as mentioned by the introducer, I'm here to briefly talk about for the next maybe 12 to 15 minutes what we have done in context of strengthening the capacity and the capability in the country as well as in the region, the countries around us, in context of management of substance use. But before I go to that part, I'll talk briefly about why is it so important or why is it so highly relevant to talk about substance use in context of SDGs or the Sustainable Developmental Goals. So that will be the first part of my presentation. We all know there are 17 of these SDGs, and although we are focusing on one particular one at this point in time, but we need to remember that SUDs or substance use disorders, and besides that, even substance use is something that is of relevance in context of many of these SDGs. It is just not restricted to the domain of health. But before I say that, I also need to kind of emphasize the kind of scale that we are talking about when it comes to substance use. For example, when it comes to the health sector and the health related issues, we usually think of individuals who are probably suffering from a problem. And that is true for so many medical disorders, because it's the person who is carrying the disease or that illness. And we tend to assume or believe that it's the person who is suffering. It's the person who is kind of losing out on opportunities. and the person needs intervention, and that should settle the issue. But when it comes to substance use, of course, the person who uses the substances and eventually ends up having the problems, which we call substance use disorder, that particular person or that individual suffers a lot, bears a lot of adverse consequences, and I'll talk about those in the next slide. But it's not just that individual who is at the receiving end here. This is a very unique kind of an issue, and it's a health issue for sure, but it's an issue that goes beyond the health, because while it is impacting health of the person who is using the substance, and there are people around this person who probably are not even using any substance, not having any substance use disorder, but they might be suffering as well. They might be experiencing the adverse consequences as well. We know whenever there is a person who is using substances excessively or in a problematic pattern in a particular family, it impacts their relations with their parents, with their siblings, with their spouse, with their children. And it's not just the interaction between this particular person who is using substance and others around him in the family. It's the interaction of the family with the extended family, with the local neighborhood or the community. Because once you have a person who has been kind of labeled as somebody who is a substance user, or more often people who are labeled as addicts, it creates a very difficult situation for others in the family, because we know there is a lot of stigma that comes along with substance use, and that is why it's not only the person, it's the whole family that kinds of gets labeled with those terms and those phrases, and they have to live with that. uh, it's not just the stigma or the bad name that it brings to them, it brings so many other challenges. It brings in economic hardships. People who are at the prime of their productive age, they are no longer functional. They may not be able to contribute financially to the family, not just financially, even emotionally to the family. So the relations are suffering there. Children for whom you need to pay their school fee, give them good food so that they grow well, that's not happening. So there is the issue of stigma, issue of finances going wrong, issue of that person being emotionally absent from that particular family. So those are the kind of issues the family faces. And it doesn't end there. The adverse consequences, they are suffered by the community as well. And we are talking about the people who live around this family. Substance use, many of the substances that people use are illicit or illegal. They are not legally available. And the channels through which they become available in the local community, they are clandestine, they are illegitimate reasons, illegal reasons. And then there is that system that gets created, which has to sustain itself in order to survive. And that includes a lot of illegal activities, lots of antisocial activities, and that is something that impacts the local community as well. The problem is that the problems don't end there, and it's the overall society that's kind of suffering the brunt of the problems related to substance use. Think of a country where the people who are supposed to contribute to its growth, they are engaging in substance use and end up having problems. So it impacts the way the country is scheduled to progress. It impacts the way the country is supposed to go ahead. And those consequences are observed at that level as well. So it's very important to talk about substance use, not only from the perspective of the person who is using it and suffering from the diagnosis, but from the perspective of the whole community, in my opinion. Also, as I mentioned in the introductory part, while we are focusing on a particular or a couple of SDGs here, the issue of substance use is cross-cutting, and it affects so many other SDGs as well. Of course, health is the primary concern because it happens to be a health-related issue. Not just physical health, there is that component of mental health as well. So health remains a core theme in context of SDGs. But we also need to remember that one of the themes that SDGs they talk about is the mortality, the premature mortality. And we know that substance use, substances like alcohol and other drugs, they increase the suicide rate significantly. People who use alcohol, they may be 10 to 14 times at a greater risk of dying prematurely because of suicide. So that's again a very important target in terms of SDG. If we need to bring down the mortality or the premature mortality, we need to cut down on the mortality because of substance use. There are SDGs that talk about nutrition. And people who use substances, they tend to neglect their food intake. And I'm not talking about just the grown-ups, people who are still growing, the children, the adolescents, and it impacts their nutritional status as well. SDGs, they talk about removing poverty, improving people's income. We know taking substances can be very expensive. They don't come cheap. And it's not worsening just the income of the person who is using it, but the whole family, as I described earlier. So that again is an SDG where substance use becomes highly relevant. So SDGs and SUDs are closely interconnected. And if we want to make any meaningful gains in context of the targets of SDG, we cannot afford to ignore substance use related issues. So that's why that theme is very important. I'll give you a brief snapshot of the kind of initiatives that we have taken in the past couple of years. And these initiatives are primarily geared towards kind of strengthening the capacity on addressing this issue in the society around us, as well as in the neighborhood of India. So most of these initiatives we have taken in context of this service that we have at AIIMS at National Drug Dependence Treatment Center. It's our telemedicine facility. We call it ENDDTC, and we are operational since the year 2014. There are different kind of resources and activities that we have created or generated over these years, and I'll mention some of them. So basically, I have categorized these into two groups. There are two kind of activities that we do mainly. One is the real-time sessions, for example, a session like this, where we engage into these activities as a real-time session. Besides that, we have also created some resources and contents which are hosted on our online portals, which people can access whenever they have time, whenever they are free, so that it becomes convenient or easier for them to access as and when they need it. So in terms of the real-time sessions, we run different kind of projects. These projects are aimed at conducting sessions which are aimed at capacity building of healthcare providers. It includes medical doctors, psychiatrists, psychologists, social workers, and even primary care health workers on different themes related to substance use. Additionally, we also offer teleconsultations through this facility where people can book appointments online and they can seek a consultation online directly from a place of their own choice, which makes it very convenient for them. We also host a lot of content using on our web portal. We have created resources that are accessible to people, and we talk about substance use from different perspectives, from the perspective of physical health, mental health, the kind of adverse consequences it can have for the community and issues like that. We created additional resources in COVID-19. I won't spend a lot of time going about it, but it is all available at our website, and you are welcome to access our website and see it all there. So these are some of the resources that we have created there. We have also created a learning platform where people can access our resources, where this content is hosted. For example, there are modules on management of substance use. There are modules on primary care health workers where they can learn how to screen and offer the intervention. We even talk about non-substance related addictions like behavioral addictions there. There are different projects that we are running. For example, there is a project with the government of Odisha where we are offering online and on-site trainings. It's a hybrid model that we follow. We are running a project with the government of Chhattisgarh where we are training the school teachers on substance use among students and how they can help prevent substance use in students as they are growing up. We are running some regional projects in collaboration with the WHO regional office. This is an online portal on alcohol use disorders where we have created resources which can be accessed online. There are different courses that are available for different healthcare providers. We run this online hub on mental health and addictive disorders. And again, we focus on substance use as well as self-harm related issues over there. And finally, we have also created some resources for healthcare providers as well, so that when they go out and they offer support to these individuals, they are able to take care of their own mental well-being. So I must acknowledge people who have been involved in these projects as well as the funding agencies. And I'll stop there. If there are any questions, I'll be more than pleased to take these questions. Thank you.
Thank you so much, sir. We are glad to know the initiatives that you have taken, you and your team have taken. So the question and answer session would be at the end. Now I would like to thank you for your, sorry, sir. Okay. Thank you, sir. Now I would like to introduce our second panelist for the day. For SDG 5, Gender Equality, Dr. Priyali Mandal. Dr. Priyali Mandal is currently working as an associate professor at National Drug Dependence Treatment Center and Department of Psychiatry, AIIMS, New Delhi. She is proficient in conducting research and publishing journals on substance use among women and adolescent groups. She has been a principal investigator and co-investigator in many of the projects related to drug use and its outcomes. She has also won many professional awards from reputed organizations for her remarkable contribution to the society. She is also a member of professional bodies like Indian Psychiatric Society and many more. We are happy to welcome you, ma'am. Thank you.
Thank you. So may I share my screen now?
Yes, ma'am, please go ahead.
Yeah, is it visible? Yeah.
Yeah.
Okay. Okay, thank the organizer for including me for this webinar. Well, when I got this topic, substance use in women and about gender equality, I wondered for some time whether should I talk about gender difference or gender equality, because unless gender is a social construct, you cannot obviously deny the biological differences and also psychosocial differences. And unless you know the difference and you don't understand the difference, you can't actually talk about gender equality. Unless you cater to the different needs of women, you can't talk about gender equality. So throughout this presentation, I'll be talking about the gender differences and how the addresses have been catered so far in the outside world and also within India. So basically till 1960 or 1970s, the research or the treatment of substance use disorder suffered a lack of data on gender diversity. Then gradually with emerging research, etc., it was understood that there are certain biological and psychosocial differences between men and women, and possibly they need to be addressed separately or in a different way. However, if I talk about the research and research which was emerging about the gender difference, it was mostly coming from the Western countries. Till now, we have been able to find out major differences in the gender differences, like certain biological differences like telescoping. Like the females, develop although the onset may be later in them, but the complications as Dr. Yatan was talking about, the complications, be it biological, be it psychosocial, all the complications, they develop a little earlier than their male counterpart. There are differential roles of the sex hormones. The psychosocial differences are much more than their male. Differences, or I would say difficulties, are much more than their male counterparts. The onset, I've already talked about. The reason for initiation is often it is by their partners under pressure or under under coercion. The course obviously takes a different, it takes a different course. The perceived social support is less. Trauma plays a very, very important role in case of women's substance use. It has been seen, I think some of you already have talked about this. The violence, gender-based violence plays a very important role in onset of substance use, in continuation. Sometimes substance use related violence is, it's completely a different topic of discussion. While both the couples are using substances, the nature of violence is all the more intense and little different. And stigma, obviously whosoever uses substance faces societal stigma, but in case of women it is double stigma. They are deviating from their roles and responsibilities, and they are using substance. It's double stigma for them. And because of certain reasons, the women face different barriers kind of at individual levels and structural levels, and also at systemic levels. There are very, very minimal representation of women in the policy and development resources. The literature, till now, the literature about the gender difference, that also, I would say that also, I mean, you can see if you try to find out literature, you will find out very limited literature compared to the substance use literature about men. It mainly comes from North America and Europe, Australia, mostly developed countries. And you hardly find any literature from African countries or South America for that matter. India is definitely, it's at a nascent stage of research about regarding research about women and working on women. So what has been done so far? So as earlier I was talking that in 1960s it was generic treatment. The treatment was male centered. The differential need of women were not catered. With a better understanding of the differences, gender differences, the gender specific treatment setup came up. Then the gender sensitive treatment settings also came up. But these things were happening in the Western world only. By gender specific, I mean the needs like, understanding the need for the need of the pregnant women, the need for child care facilities inside the residential facility for women, understanding the need for, long-term care, etc. And also addressing the need for domestic violence and the need for safety and security. Later, the concept of gender sensitive interventions came up, where it was kind of understanding their need and also addressing them in a sensitive manner, like giving importance to the trauma they face in their life. So these kind of interventions become very, very popular in America particularly, and also some part of Europe. These settings, they are working in outpatient and also residential and community setting, and also in the hospital-based and correctional settings. But it was mostly, I mean, if I summarize the findings of these, gender sensitive settings, it was found that, even there is not much of strong evidence of differential outcome. But it was seen that if women are given treatment in a separate setting, the kind of service utilization is much more than if the services is provided in a mixed setting. And but there are certain issues like, although there are settings coming up, but there was lack of experimental studies, like, after taking up some patients and then seeing how it is working, evaluating and assessing it, and what are the outcomes. Most of the treatment settings which had come up they had small samples. The sample was heterogeneous. There was lack of thorough program description in most of the research studies what I've gone through. Lack of thorough statistical analysis is also there. Limited range of treatment outcomes were examined, so we actually did not know how much of them were effective. And obviously and since the description was not there, so we don't know how much of the in the cultural aspects where playing role and how much of it we can, we can use them in our country, in our setup. So where does India stand? Let us see. Till date, India, I would say till 2000 onwards, the research regarding women substance use started coming up. In our, there are like big studies involving more than 6,000 women were done by Dr. Pratima Murthy, and there are many more studies that had come up. The studies also address the problem of substance use among women in Northeast, who are like mostly injecting drug users, and having the problem of the pandemic of, there is an epidemic of HIV. So from the Indian studies, what we could summarize is that the women substance user in India, they have significantly higher level of physical and sexual violence. They have premarital and extramarital sex, exchange sex for money, and voluntary or under coercion, multiple sexual partners. The reason for initiation have been mostly due to childhood difficulties, peer and partner influence, under coercion, physical emotional distress, and also iatrogenic causes. Many women, as in our clinic, we see that they start their substance use due to some undiagnosed mental or physical condition. They have it mostly it is chronic pain or some depression or maybe anxiety disorder. And unfortunately, the women are they use the services very, very poorly. There's the utilization rate, even in community services, even the services at their doorstep, they don't use it properly. The family planning methods, they are very, very less likely to utilize the family planning methods as well. And the very important thing is the females, the children of female substance users also suffer a lot because of their parental substance use. It is seen in longitudinal studies that there is high rate of alcohol and drug use among the children of, particularly if the mother is a substance user, the rate is even higher. If the both parents are substance user, the rates are even higher. And more emotional and behavioral problems are also noted among the offspring of a female substance user. There's academic failure, there is great level of literacy and school dropout, etc. And there is, you're all aware, there is fetal alcohol syndrome. If the mother is using alcohol during pregnancy, it comes with array of developmental problems. And there is neonatal abstinence syndrome. If the mother is using opioid, particularly illicit opioid, there is neonatal abstinence syndrome. It could be a life-threatening condition for the newborn baby. While we studied the treatment-seeking population, we again found we had some similar kind of finding. Like they had a lot of they had a lot of stigma. They had physical and psychological complications, developing earlier than their male counterparts, and many of them had comorbid psychiatric illness also. So they are most, like as we see in men, they start their substance use mostly out of curiosity or kind of to entertain them. But for females, it is mostly seen that they start their substance use, obviously many a times under coercion from the partner, but many of them also had comorbid psychiatric illness. Now that could be secondary to the substance use problem, or that could be a primary problem due to which the females start their substance use. And because of this very reason of having psychiatric illness very commonly, the use of over-the-counter drugs like benzodiazepine, sleep medications is much more than their male counterparts. So the overall, the total number of female using substance, maybe the absolute number, if you take, it may be less. It may be less there than men, but the concerns are many. First of all, they are possibly not that less. Possibly we are not able to catch them up. We are not assuming the proper method of catching them up. the method of epidemiological method should be possibly we need to take specialized steps. The females, they have a faster progression and develop more complications than their male counterpart. They suffer more domestic violence. The HIV vulnerability is also much more than their male counterparts. They suffer more stigma, and last but not the least, the concerns about their children, the children of the female substance user. Where do we stand addressing how much we have been able to address the problem of women in India? At our center, till date, I think we have hardly a handful of centers who are catering to the needs of women substance users in the country. Our center is one of them, and there are three or four centers in Manipur. One of them are in Mizoram. Punjab government also has taken a recent initiative regarding catering to the needs of women drug users. We at a National Drug Dependence Treatment Center, we are trying to generate evidence, which is the first step to possibly go towards gender equality if we talk about substance use by women, because we need to know what is the difference and that's how we will come to know how to cater to the needs of those differences. NDTC has conducted surveys in 2004, 2019 national survey funded by Ministry of Social Justice and Empowerment, and could find out the problem, how the severe the problem is also among women. We have established a specialty clinic for women since 2000. It is running since 2015. Currently, we are seeing about, we have registered about 600 till date. We have registered about 600 women patients. This is a poor old data. It's not 100, 600. We are collaborating with other departments because these women have, as I was talking, they have more complications. They have, they have different needs, like the parenting needs. They have gynae, and we need to collaborate with gynae and obstetric department because of their, when a pregnant women come, when a lactating women come, we have to often collaborate with them. And we are obviously publishing research studies, and we have published clinic-based papers also. So we actually have to go a long way where we stand, where we even don't know clearly the differences. But before, if we want to know, we need to sensitize the policymakers. The first thing what we're trying to do probably through these webinars and other platforms. The policymakers, it's good that the Ministry of Social Justice and Empowerment has been taking initiatives to address this need. We need to generate culture specific and region specific data. What kind of treatment need may be different in a Western country than an Indian woman who is who is culturally different. We need to take measures to allay stigma. We need to reach out to the users, possibly more of community settings, more community centers, particularly catering to the need for women, maybe run by women, and more of female staffs. And these things, with small steps, can be taken up while we are thinking of community services. Then obviously we need to involve all the stakeholders regarding this. We propose, proposing that we should bring in more NGOs who are working in the field, collaborate with them for awareness generation, for development of IEC material, and we need to collaborate with stakeholders in developing evidence-based comprehensive treatment models. And possibly more and more women participation is also needed. Will understand the need of women in particular. And I also would propose, rather it would be my dream to propose this career as women addiction specialist. Thank you.
Thank you, ma'am. It was very insightful. Through your session, we were able to understand the importance of gender-specific and gender-sensitive interventions and ideas for way forward. Thank you, ma'am. Now, I would like to call upon Dr. K.P. Manojan for our last session of the day for SDG 10, Reduced Inequalities. I would like to give a brief intro on Dr. K.P. Manojan. He is currently working as an assistant professor at Tata Institute of Social Sciences. He completed his PhD in 2018 on human rights and MPhil in 2012 on social exclusion and inclusive policy from University of Hyderabad. His PhD work was an ethnographic study based on Adivasi children in Kerala, looking at how their educational experiences are taking place and thereby forming their subjectives. Besides these, Dr. Manojan also holds a master's degree in education, and before joining Tata Institute of Social Sciences, he was working as a faculty at Regional Institute of Education, Bhubaneswar. We are happy to welcome you, sir. Thank you.
Thank you. I hope I'm audible.
Yes, sir, you are.
Thank you for the organizers for inviting me to. So Sam, it's very much right and with the way intervention that have taken by Professor Gupta and Dr. Piani of substance abuse and all. So basically, the theme that we have.
Hello, sir. So sorry to interrupt
hello.
you. Your volume is really low. If you can hold the mic closer, that will be very helpful.
Okay. Is it okay now? Hello?
Still a little low.
Okay. Now is it fine?
Yeah, okay, I think we can proceed. Yeah.
Okay, fine. So, see, what I was thinking about the different themes that we have discussed about the Sustainable Development Goal, and Dr. Balara was describing about the interconnectivity and interconnectedness between the different Sustainable Development Goals. How it largely create a productive and an inclusive society that is very sensitive about the discrimination and the different kinds of inequalities that are existing in our society. Okay. So when we talk about the Sustainable Development Goal by number in 10, the kind of inequality or the nature of inequality that taking place in the different context of the society. So if you take to the larger level, globally, if you're looking into the societies, like if we something from the African region, sub-Saharan regions, how it works, the forms of inequality it works there, and something that is happening in the South Asian region where we belong, what kind of inequality it exists, and globally, like what is the nature of the societies that are experiencing different forms of inequalities. Okay. So on to these inequalities, like if we see, look at the data and all, like I mean, it's very generally we say that, or the evidently the development reports which announces that, see, 2% in 10 are obviously engaging with the different, experiencing different forms of discrimination. And no, it's in the form of gender, it's in the form of race, ethnicity, the sexuality, and all this kind of, the identities and the social locations. So how do we able to connect this larger arena of inequality in terms of nation states and in terms of producing a society which is free from different kinds of social evils, right? So if you look at the growth of the society, or if you look at the changes that are happening in the recently, for example, like how these cultural changes are happening and how these cultural changes are taking the legacies from the socio-economical changes that are framed in the society as a structural change, mostly from the state-led policies and all. Okay. So, for example, in the cases of wage difference, or the case of increased migration that are happening in the different parts of the globe and the country as well. So how it all are creating different forms of, the experiences of the marginalization for these the citizens in different countries, right? So why we look at this these differences in society or this inequality in society in terms of a hindrance that against social change or any kind of social progression that are going to make through the policies, and also an obstruction within the members of the society itself. Okay. So we see that where these changes are happening or where these polarizations are happening, right? So whether the people in our country or the people in our neighborhoods are having a life that is free from different forms of discrimination or the experiences of exploitation and all, right? And how it leads to the I mean the kind of well-being or the kind of the subsistence living they live, and how they lead to different forms of kind of aberrations that we talk about, something like substance abuse and all. Okay, so we see this is something very much common, which is something happening with the socio-cultural changes that are happening globally. The amount of exposure that people used to receive, and the amount of the amount of the socio-cultural exposure that the generally from the new generations, like the youth, adolescents, and the children who are in educational institutions, and the people who are at the different the urban rural counterparts. So how they are exposed to different kinds of this kind of inequalities and these vulnerabilities, how it will eventually lead to the these substance abuses or other forms of deviations that we consider as a an aberration to the overall growth trend. So see, if you look at it in the larger level, so we can find the different forms of inequalities that stems from the gender and the amount of vulnerability of the different genders are experiencing under the society, and especially the substance abuse as a reason that makes people more vulnerable, the women and children especially. So, like, how do we able to take this amount of changes or amount of inequalities that are existing in society in confidence with the civil society? So how would be taking the government or how the social policies are able to bring about the civil society into the confidence towards the fight against inequality, and also for an inclusive society that free from the aberrations like substance abuse and all. So I think you might have heard about, we might have experienced in different forms of NGOs, political organizations, political parties, which are all taking part. Only very recently, we are experiencing different forms of interventions which are carried out by the civil society organization, making conscious about the general public against the drug abuse and how it connects with the larger sense of inequality that they experience. So I think this should be one of the major imperative for all of us to making into the confidence of the civil society towards building a consciousness towards a healthy society. So how it would would be able to make changes among the the present generations, for example, like the youth, adolescents, the learning community, students, or many other immediate stakeholders who are very much vulnerable to the the evil that they are going to experience in whenever they get to different exposures. So it's a kind of a a kind of a larger impact of the social changes. So we should see it in that form where like how this is changing. This is not something not suddenly happening, but it's also a part of the larger socio-political change that is taking place in the globally. So one of me as a teacher that engages mostly with the learning group like youth and adolescents. So like it's something like that. How do we able to bring them in confidence towards leading a healthy life? That also becoming as a the model for the coming generation which are into the same kind of culture. So I mean, so the mostly the making the civil society or the different stakeholders into confidence towards making a healthy society. So I think that would be the one of the possible the way in which where we can make a collective consciousness among the public in terms of engaging with this kind of issue. So like the something like education institutions and voluntary organizations, NGOs, or the other forms of political organizations, or the so whoever who can engage with the or making the civil society more conscious enough to engage with this kind of issues. I think this would be one of the possible way in which where policymakers can take part in the the larger way of making inclusive society far better. So I think this would be something on my side. So with the 15 minutes, something maximum possibly like we can try to make that kind of a consciousness, including like the the educators, mostly the people who are from the technical field, medical field, public health field, and also the other people who can contribute within they can make a direct impact in the society in a very near forms of intervention. So I think I will stop here. So like we can just go. Thank you.
Thank you, Dr. Manojan. I think you've very well, in a very good manner, you've linked social policy and the criticality of social policy and the need for us to take a multi-stakeholder approach in fighting drug dependency. I think all the panelists have given us bits which all connect and build a large picture for us. So to carry on the conversation, we have a few questions coming in from Facebook and also from within our own discussions among the team that we would like to ask the panelists. So, I mean, the first question from my end would be like to Dr. Balara. You were linking mental health and, you were talking of how we cannot speak of SDGs also as one or two. Like all of them are very well interconnected to each other and how all of it gets impacted when we are talking of drug use. So like one question that I do have is when we talk of youth and mental health, and especially in the contemporary times where we have a sedentary lifestyle, where we have a lot of newer factors which are impacting mental health of especially the younger generation, let's say social media and a lot of other kind of influences which probably didn't exist as strongly as they do in today's time. So like, could you elaborate on this connection and tell us how, in the contemporary time, how is youth's mental health being affected and how is it making them more vulnerable to drug use, among them? So yeah, please.
So the interconnect between mental health and mental well-being and substance use has been there for many years. That that close relation that these two conditions share, there is no debate over that. Uh, it has been very well documented that people who experience stress early in their life, people who experience abuse, which includes physical as well as sexual abuse, they are more prone to experience substance use as well as substance use disorders. Also, it's a very well documented finding that people who tend to have depression or anxiety, or even certain childhood or adolescent disorders, for example, ADHD, if they remain untreated, their chances of picking up substance use are higher, and eventually developing substance use disorders is also higher. But this is not a one-way connection. It's not that only mental health issues lead to substance use. The other way around is also true. There are people who start using substances, end up with a substance use disorder, and then they start experiencing mental health issues. This includes depressive disorders, anxiety disorders. Some substances can even cause psychosis. So this is a very closely connected relation that these two set of disorders have. Also, you have made a very important point. Traditionally, when we talked about addiction, we always talked about drugs, alcohol, tobacco, and we thought that there has to be a chemical to which human beings can get addicted. But these days, people have started talking about something that is called as behavioral addictions. And what that means is that it need not be a chemical, it can be just a behavior which can make you habitual to itself, which can make you lose control when you are engaging in that behavior, which can make you neglect your alternate responsibilities to the extent that you it becomes detrimental to your well-being. So behavioral addictions is a reality of modern day. And when it comes to our youth, usually the technology related addictions like internet related addictions, mobile phone related problems, gaming related behavior, that are the main concerns that we are facing. And these problems can be as bad or even worse than the problems that people with substance use disorders experience, for a couple of reasons. First, we are not yet aware. So we tend to kind of ignore even when the problem comes, and we tend to assume that it's just a bad habit, but it might be a mental health issue that you are developing. Second, since it's happening in those formative years, it kind of hampers your growth for the rest of your life in many cases. For example, it can psychologically impact you, it can academically impact you, it can professionally impact you later on in your life. Also, what is important that even these addictive behaviors, they are very closely connected to substance use as well as other mental health issues. So people who tend to have excessive or problematic use of internet or gaming or social media might have more mental health problems as compared to people who don't have these issues. So it's all very closely interconnected, and it just doesn't end there. Since a lot of these activities are done as sedentary behavior, people are just sitting, playing on their mobile phones, watching something on their laptops or TVs, it leads to so many physical problems as well. So it's a whole gamut of issues that we're talking about, and we need to talk it from all the perspectives, many of those that we are discussing today. And there are themes beyond this discussion that we need to bring into picture so that we can have a very holistic understanding as well as a multi-pronged response, so to say, to address this issue.
Thank you, Dr. Balara. I think that is very, very important for us to understand how different forms of addiction are then eventually, getting connected to substance use disorders and also mental health, of course. And what you also said about looking beyond what we are looking at today. So, like, even in the past, we've had a few panel discussions which have brought in intersectionalities of gender beyond just women, or understanding destitution and drug use. So I think all of this together shall help us build a more holistic understanding of drug using patterns in India today. Moving further to Dr. Mandal. So you've talked extensively about women and what specifically about what leads to women beginning to consume drugs and move towards drug dependency. One very critical question that I have is with respect to the patterns that you've seen within adolescent girls, because I've had a chance to visit a center which caters to adolescent girls who are drug users. And you see girls who are as young as 5, 6 who have started consuming drugs in different forms and capacities. So, based on your experience and understanding of this, could you just elaborate on the patterns? Yes.
Yeah, first of all, the treatment seeking of adolescent drug users is very, very less. They're very, very poor treatment seekers. Unless their substance use catch parental attention, they don't come into treatment on their own. Most of them. So if I like to give you, I mean, if I can give you a figure, like if you talk about adolescent girls, for last over 20 years, data says from our center, it says hardly 1.8% of the total adolescents. The adolescents, female, are hardly 1.8% of the total adolescents seeking treatment to our center. So, so you can understand how the figures are very, very low. The next thing is how they're different. If you talk about adolescent girls, like unfortunately in India, or what we can see, that for the adolescent girls, this reason for treatment seeking is the same as their male counterparts. They are curious about the drugs. They are, along with their male friends, they are starting their drug use. It's not about depression or anxiety as for older women. And the pattern of substance use is almost similar. The gateway effect is also seen. Like they start with the easily available, legally available substances like tobacco, like some of the cannabis products. Then they move on to higher or harder substances like heroin or other substances. However, the substance use progression is very, very fast. They develop complications faster. They go into injecting drug use very, very fast than their male counterparts. And also, the number of teenage pregnancy, the percentage of teenage pregnancy is very high, alarmingly high among adolescent girls using substances. Unfortunately, we have very, very less, a number of studies addressing the problem of substance use among adolescent girls. But I think this is need of the hour. The ministry, I mean, all the stakeholders should focus on adolescent girls substance use.
I think that's a very important point, and I think the one complexity which also comes because I visited a residential complex for girls, so there you have to really look at all factors. First is just the stigma is triple now because the girl is much younger, and you need to involve child welfare committees because you cannot just deal with children like that, especially if the parents aren't involved directly. So I think the kind of approach also needs to be much more nuanced, and it needs to understand the complexity of the relation, and especially dealing with children and especially female
Yeah,
children.
one more thing I would
And
like to add. One more thing
yeah,
I'd like to add is the adolescent girls, they are abandoned at a much higher rate than by their family members. If an adolescent boy is using substance, the parents are more into treatment seeking. But if an adolescent girl is using, they are more into kind of abandoning the child. Particularly in lower socioeconomic status, it is very, very commonly seen. They just completely abandon the child. Thank you.
yeah. Thank you so much, Dr. Mandal, for that. And to Dr. Manochan, you have talked extensively about structural inequalities and how we need to bring together civil society organizations and, again, multiple stakeholders who can come together to build a more equitable approach towards fighting drug use. So my question really is, so like in women's case, we have discussed how because of their discriminatory practices, the trauma that they have from gender-based violence, often they give in to drug use or they begin drug use because of anxiety and depression, which could often arise from gender-based discrimination that they are facing in their life on an everyday basis. So, do we also see such patterns in groups of other socio-cultural identities who might be marginalized, who might be vulnerable, and how the discriminatory practices in the society could probably be pushing them, into drug use, and also keeping in mind not just social discrimination, but also other forms of lack of access, for example, to jobs, to economic benefits, health, and all of that. So, if you can just tell us more about that.
Yeah, that's a very, one of the very core aspect of, how the vulnerabilities are leading people to, into the abuse center. So, for example, see the migrant population that, or the people who are engaged in the, the migrant structures. Like how they are getting exposed to the different forms of, exposure that are available, and also how the social conditions are eventually leading them to get into those places, right? So generally, if you look at how that new cultures, for example, the urban regions, for example, the slum regions, for example, or the way in which the country, the we say the outskirts, for example. So how the different, the deviance, for example, the how people becomes are the agents of distribution. So who are the people becoming the agents of the distribution, right? So like it's mostly who are the vulnerable to that, get into that kind of wages or that kind of the perks that they are going to this dangerous job and all. Like you see like where are the places they are going to distribute this kind of stuff. Look, for example, educational institutions, right? Or the other places where the people can easily get into the, the availability, right? So it's a kind of, the larger connectivity among the people, right? So within that, how the sectors, how the different sections who are at the margins, right? Within the the outskirts, for example, or the even within the the many regions of the rural sides also, for example, among the tribal communities, among the the people who are working in the risky jobs or the hazardous jobs, right? And also you can also see that people are using it as a tool to exploit the workers also, right? For example, the sugarcane industries or the the different, for example, our region, Karnataka, that region. So people are hired for different farm fields and all. So the money lenders or the contract people, they used to provide it as a remuneration instead of the actual wage they have to give. So whom do we blame in that? So the entire structure of exploitation itself becomes a very part of abusing the vulnerable populations, or the marginality. Where it comes, it doesn't matter, but being marginal becomes a universal phenomenon, right? So that's what the nature of the very nature of the inequality itself is very much deep rooted in this kind of the the structural nature of exploitation. So I think this would be something at every every domain we can see this kind of differences, how it leads to the vulnerability, large percent. Yeah.
And I think, sir, you really well pointed out how in construction sites and especially in manual labor, they're given drugs as a incentive. Similarly, we've heard of like the waste picking community and how, because the smell of that whole place of work that they go to is so strong that they're not able to bear it. So often the contractors give drugs to kind of make it easier for them, quote unquote. And they also, because a lot of children are involved in the profession of waste picking, they automatically get pushed into the domain of drug use and eventually dependency at a very, very young age. Like we've seen children who are 3, 4, and they've started consuming fluids, especially whitener and other forms, which they start drug use from. So I think it's very, very critical for us to look at all of this in a much more holistic sense, and to also look at these nuanced understandings which have been brought in today's discussion. One question, this is open to everybody. We are talking about how we've talked primarily about what leads people into drug use and dependency. But could you also, any of you, can you share your thoughts on how, drug users become vulnerable to violence? So we've seen that in the case of women and people of other genders and other social identities. So if any of you would like to go ahead and share a little more on that, that will be really helpful.
I think everyone can add to this, but still, I think the way the transgender communities, like I mean, in the urbans, in the metro cities, for example. So there are many instances in which this the people from transgender communities or people who are engaged in the sex work portion or into the sex work and all. Like I mean, they are taken by the groups and they were making the people use drugs, and also like I mean an intense amount of violence that has been, it's done towards the transgender community. So many cases of the police reports, if you go to the metro cities or even in the district headquarters of the most of these cities where these, the transgender people are very much into the, urban city life and all. You can see, I mean, the large amount of, I mean, very intense amount of violence, physical violence, torture, they experienced by the transgender communities, and even people are exposed to kill, right? So I mean there are instances in Goa. We had an incident of intense drug abuse, and people finally got physically tortured and later committed suicide. So I'm not revealing it, but these are all something very much part of this. So especially this is the vulnerability. It's a major factor to exert violence. So people know those who are into this power dominant psyche. Like people always find people who can exercise their power. So generally people who are into the bottom layer are subject to this. So it is something very rampant nowadays. Especially for the last 2-3 decades. Okay. I think someone other panelists can also add. Just
If I were to add something to this, it's true that many people who use substances, they tend to be in those situations that are physically hazardous. It may be because A, for the reasons such as the financial reasons where they have to secure money in order to buy the substances that they're trying to consume. Some of the people, they have to resort to certain activities that increase the risk of physical violence, particularly in context of women substance users. They might also have to indulge into transactional sexual behavior as well, which again is a very risky situation for them. But it may not always be a person who is using a substance and ending up experiencing violence. For example, I talked about how substance use impacts the family. So if there is a family member who is using substance and uh, he has a wife who is not using a substance, the wife can be at risk of intimate partner violence because of the spousal substance use. So that's the other kind of violence that comes into picture. It's not just the spouse, but even the children are at greater risk of experiencing physical abuse in these cases. But we must also remember that people who use substances, they are more likely to be victims of violence rather than being the people who perpetrate the violence. Because uh, once you are seen as a person who is an addict, you tend to be blamed for whatever wrong happens around you. You might be found or you might be accused of things going wrong, any other crime that has been committed in the locality. You might become an automatic suspect in such a case. Also, the stigma that it carries along with it. So it's again a very complex theme where the violence somehow becomes a very integral part of the daily life of some people who engage with substance use. So we need to approach it from all those angles, that how somebody who uses substances is involved with violence, as well as people in the family who are not using substances but still are kind of experiencing violence. So that will probably a more holistic picture of the.
Yeah, I would like to bring an interesting thing to it. Like we in our clinic, we often see couples presenting as substance user, and both of them are in need for treatment. But here also you see a different kind of kind of violence. Um, like when the medicines are given, the husband often takes away the medicine. The wife is not given the medicine at all. Sometimes or maybe the not the required dose, less. And because of the double stigmas, although both of them are seeking treatment, the families still have this kind of stigmatized view to the female the female treatment seeker. She is not allowed to come for follow-up. She is, the family members say, why are you going to the hospital again and again? Kind of resistance to treatment. These are also sort of, you can say, kind of violence only. And the physical violence is also there. Violence, sexual violence, as Dr. Yatan rightly pointed out, often in context of sexual relations. It is happening in exchange of sex. These things are very, very commonly found among female substance users.
Thank you. Thank you to all the panelists. And I think Dr. Mandal, you made a very important point about just generally, women's access to health and how that in itself becomes a form of violence when they are not allowed outrightly or covertly to access healthcare services in general, and specifically in the case of drug use. So thank you very much to all the panelists. Before I pass on the mic to Guru to give the closing note, I would request everybody to switch on their camera for a picture so that we can have a proper picture of all of us. Requesting all the team members also to switch on their camera. We can all smile. All right. Okay, I will now pass it on to Guru to give the closing note. Thank you.
Thank you, Shreya. Am I audible? Yeah. Yes, thank you. So with this, we come to the end.
schedules to participate in the panel and for bringing in such critical points, which often remain undiscussed in the mainstream. A big thank you to all the attendees who have joined us on Facebook Live. Hope we are all taking many new learnings from this discussion. While today's event has come to a close, we have a series of events planned until the 9th of December. You can follow us on our social media pages to know more about these. The links to our social media channels have been put up in the chat box. Hope to see you all in the upcoming events too. Thank you. Have a nice day.
Thank you.
Thank you.